Hi, my name is Charlene Sweeney, and I am a practice management speaker and consultant, and here's my expert tip for the day. I'd like to address the uncomfortable subject of dealing with employees who are not meeting your expectations. It's a very difficult subject in dentistry, but we have a saying, and it's this: it usually takes a dentist about 2 weeks to figure out they've got the wrong employee and about 2 years to do something about it. I think that dentists are natural caregivers, and confrontation is something that they avoid. I think it's very important, however, to address those employees who may not be meeting your expectations. And the first way to ensure that they are is to have them clearly defined in your human resource manual, both from a technical aspect and a behavioral aspect. Because if an employee is not meeting your expectations technically, addressing those shortcomings is actually being proactive in helping being solution-oriented. Because if they're not meeting your expectations technically, it's easy to offer to pay tuition for a continuing education course, to perhaps stay after work and work with them on whatever area that they are deficient in. If their deficiency is behavioral, then it's easy to sit down with them with your human resource manual and share with them what is more appropriate, perhaps in terms of punctuality, attendance, attire, cell phone use, many of the things that are creating stress in a practice for dentists today. What dentists need to understand is that by allowing employees who may not be meeting your expectations to continue to poorly perform, you lose the respect of the team members who are going above and beyond. So it's a leadership issue. You're not doing anyone any favors by continuing to allow poor performers to behave that way in your practice. One of the things I'd also like to share is that I like to tell my clients, every situation you find yourself in, you've either created it or enabled it. So when it comes to employees who are not meeting your expectations, you owe it to your patients, you owe it to yourself, and you owe it to their teammates to not be an enabler. And that would be my expert tip for the day.